Welcome everyone to Mr. Senior Health. Asterisk today, we're diving into a crucial topic, often overlooked, especially as we enter our golden years, the strength and stability of your legs. Asterisk in the next 90 seconds. You're going to discover a circulatory vitamin that prevents dangerous falls and bone-directing nutrients that keep calcium out of your arteries. Asterisk. Imagine stepping out of bed tomorrow morning, expecting your legs to feel stable and strong, but instead, your calf muscles seize up with a painful cramp. You grab your nightstand for balance, your leg muscles trembling with a weakness you can't explain. What you don't know is, could. That'd be an underlying nutrient deficiency that's slowly robbing your leg strength, balance, and independence. Asterisk in the next 3 minutes, I'll show you which vitamin deficiency causes those painful leg cramps most seniors overlook. That revelation comes from research published in the Journal of Clinical Endocrinology and Metabolism. Hang on at the 3-minute mark. Then, you'll discover the nerve-protecting vitamin most doctors never mention. Asterisk. Stay with me. I'm about to hand you 7 essential vitamins that can transform weak, cramping legs into strong, sturdy pillars of independence. Plus, I'll reveal which vitamin deficiency is silently destroying your muscle coordination while you sleep. Asterisk, if you think weak legs are just a part of aging, you're not alone. But you could be missing a vital truth. Most seniors believe muscle weakness and frequent cramping are unavoidable consequences of getting older. That assumption keeps them from discovering the real culprit behind their struggles. Asterisk research shows specific vitamin deficiencies can cause muscle weakness, painful cramps, and balance problems. They can even interfere with nerve signals to your legs. This isn't about accepting decline as normal. It's about understanding which nutrients your aging muscles desperately need, and which deficiencies can quietly undermine your mobility every single day. Asterisk. The role of nutrition in leg health. Asterisk, this information can literally restore the strength in your legs and the confidence you thought was gone forever. Quick note, today's tips are educational, not personalized medical advice. Type strong legs in the comments if you're ready to learn which 7 vitamins can stop muscle cramps, strengthen bones, and keep your legs sturdy for years to come. Asterisk, here's what most people don't understand. About leg strength and aging, weakness isn't just about losing muscle. It's about your body losing its ability to properly absorb and use nutrients vital for normal muscle function, nerve signaling, and bone density. Asterisk Harvard research shows that seniors who maintain optimal vitamin levels keep stronger legs, prevent more falls, and maintain better balance compared to those with nutrient deficiencies. Asterisk few seniors realize this hidden opportunity. The right vitamins can restore nerve communication to your leg muscles. They provide the muscle building blocks for bone density that help keep legs structurally sound. They deliver compounds that prevent muscle cramps and maintain the energy your legs need for stability and movement. Asterisk 7 essential vitamins for strong legs. Asterisk essential vitamin. Number 1. Vitamin D asterisk. Here's why this is the powerhouse vitamin for leg strength. As we age, our skin becomes less efficient at producing vitamin D from sunlight. Many seniors spend less time outdoors due to mobility concerns or weather. Asterisk as a result. A widespread deficiency silently undermines muscle strength, leading to weak and unsteady legs. Studies consistently show that low vitamin D levels are directly linked to muscle weakness and an increased risk of falls in older adults. Asterisk research published in the Journal of Clinical Endocrinology and Metabolism found something remarkable. Seniors with adequate vitamin D levels had stronger muscle fibers, better coordination, and improved balance. They were less likely to experience injuries and fractures. Vitamin D directly impacts muscle function by enhancing protein synthesis and improving nerve-muscle communication. Think of it as fuel for your leg muscles. Without it, they struggle to perform optimal. Asterisk research shows vitamin D maintains fast-twitch muscle fibers that are crucial for quick reactions and balance. These fibers help prevent falls by allowing legs to react quickly when balance is compromised. Asterisk, the most effective ways to boost vitamin D include sensible sun exposure, spending 15 to 30 minutes in direct sunlight daily, incorporate vitamin D-rich foods like fatty fish, fortified milk, and egg yolks. For many seniors, especially those with limited outdoor time, a vitamin D supplement is essential. Most people need 800 to 1000 IU daily. Stay below 4000 IU unless your doctor advises otherwise. Asterisk, in 60 seconds. You'll hear about the mineral that can transform nighttime calf cramps into a distant memory. Asterisk, essential vitamin number 2, calcium. Asterisk, last winter, my neighbor Ruth slipped on her porch. A minor hip fracture took away 6 months of her freedom, all because her bones were starving for calcium. Here's why your legs need this structural foundation. Like younger individuals whose bones are actively regenerating, older adults experience gradual bone mass loss. This makes them more susceptible to hip fractures, femur breaks, and stress fractures in the lower limbs. These are among the most serious injuries older adults face. Asterisk, but calcium's role extends beyond bone strength. Crucial for muscle contraction. Every movement relies on complex interactions between calcium ions and muscle fibers. Calcium triggers muscle contraction, ensuring smooth, controlled movements. Without enough calcium, muscles can cramp, feel weak, or be unable to generate the force needed for stability. Many individuals with calcium deficiencies frequently experience leg cramps, sluggish movements, and reduced muscle endurance. Asterisk, dairy products like milk, yogurt, and cheese remain excellent calcium sources. An 8-ounce glass of fortified milk provides about 300 milligrams of calcium. Leafy greens, almonds, tofu, sardines, and fortified plant milks also provide excellent calcium content. For older adults, the daily recommended intake is 1,000 to 1,200 milligrams of calcium. This should come from a combination of natural foods and supplements when necessary. Asterisk, beyond intake, exercise is vital. Weight-bearing exercises like walking and resistance training stimulate bone remodeling and direct calcium right where it's needed most. Asterisk, in 60 seconds. You'll discover the courageous, nerve-protecting vitamin most doctors overlook, plus the mineral that stops nighttime leg cramps almost instantly. In 30 seconds, you'll learn about the master muscle regulator that can end your painful leg cramps tonight. Asterisk, essential vitamin number 3, vitamin B12. Asterisk. Here's why this is the nerve communication vitamin your legs can't live without. A while. Many conversations around leg strength focus on calcium and protein. Few realize that vitamin B12 plays a fundamental role in nervous system muscle function. It keeps nerves healthy, ensuring electrical impulses traveling through your spinal cord into your legs remain strong and precise. Asterisk, quick note. If you're on thyroid medication, blood pressure, or statin drugs, discuss vitamin options with your doctor. Asterisk, without enough B12, muscles don't receive proper signals. This leads to weakness, instability, and a gradual loss of movement control. One of the most common vitamin B12 deficiency symptoms is heavy, tired legs, often accompanied by numbness or tingling. Common in older adults, asterisk, unlike other vitamins, B12 absorption relies heavily on digestive health. The body needs adequate stomach acid and intrinsic factor protein to extract B12 from food. As we age, stomach acid production declines. Conditions like gastritis, acid reflux, and long-term use of antacid medications reduce absorption. Asterisk, unaddressed B12 decline can lead to irreversible nerve damage impacting balance, coordination, and reflexes. Many seniors who frequently experience falls, difficulty walking, or legs that just don't work like they used to are truly experiencing the neurological impact of B12 deficiency. The best B12 sources include lean meats, fish, eggs, dairy, and shellfish, especially clams and liver. 3 ounces, about 85 grams of salmon, provides around 4.8 micrograms of B12. For those on plant-based diets or with absorption difficulties, B12 fortified foods or supplements become essential. B12 is extremely safe to supplement, as excess amounts are excreted in urine. Asterisk. Essential vitamin number 4. Magnesium. Asterisk. Here's why this is the master muscle regulator that stops painful cramps. Every time you take a step, magnesium ensures your muscles receive signals to contract and relax smoothly. It acts as a primary regulator of muscle function, preventing spasms, reducing fatigue, and supporting endurance. Asterisk. One of the most common but least known magnesium deficiency symptoms is restless leg syndrome and frequent nighttime leg cramps. Many seniors experience sudden, painful muscle contractions in their legs, especially at night. This disrupts sleep and makes daily activities tough to recover from. Asterisk. Magnesium helps calm overactive nerve signals and prevents muscles from suddenly seizing up. This makes it essential for those struggling with muscle tension and involuntary contractions. But magnesium's role isn't limited to muscles. It's crucial for bone density and joint health. Magnesium helps regulate calcium transport, ensuring it's properly directed into bones rather than depositing in soft tissues, where it can contribute to joint stiffness and pain. Asterisk. Studies show higher magnesium intake is associated with greater bone strength and reduced fracture risk in aging adults. The best dietary magnesium sources include leafy green vegetables, nuts, seeds, whole grains, and legumes. Foods like pumpkin seeds, almonds, spinach, black beans, and avocados are especially rich in magnesium. For those struggling with dietary intake, magnesium supplements can be effective. Aim for 310 to 420 milligrams a day from food and supplements combined. Magnesium citrate or magnesium glycinate are more absorbable forms. Asterisk. Essential vitamin number 5. Potassium. Asterisk. Here's why potassium prevents muscle cramps that wake you up at night. Muscle cramps are one of the most common potassium deficiency symptoms. Potassium regulates muscle function by balancing fluids inside and outside muscle cells. When potassium levels drop, muscles contract involuntarily, leading to painful cramps, especially in the legs. For older adults who may already have reduced circulation or muscle mass, these cramps can be debilitating. Muscle cramps are just the beginning. Asterisk. Potassium transmits signals between nerves and muscles, ensuring smooth, controlled movements. When levels are low, communication between your brain and leg muscles becomes less efficient. The daily recommended potassium intake is 2,600 milligrams for women and 3,400 milligrams for men.
Ow.
This is typically achievable through a balanced diet rich in fruits, vegetables, and legumes. Asterisk. However, those with kidney disease or high blood pressure should monitor their intake carefully. Check with your doctor if you have kidney issues before increasing potassium-rich foods. In 2 minutes, you'll learn about the traffic directing vitamin that guides calcium exactly where your bones need it most. Asterisk. Essential vitamin number 6. Vitamin K. Asterisk. Here's why this vitamin K directs calcium to strengthen bones instead of hardening arteries. When people think of bone-strengthening vitamins, calcium and vitamin D often take all the attention. But without vitamin K, these nutrients can't work properly. Vitamin K ensures calcium is deposited in the bones where it belongs rather than accumulating in arteries or soft tissues. Asterisk. Vitamin K acts as a traffic controller, guiding calcium to the right places and keeping legs structurally sound and mobile. Studies show individuals with higher vitamin K intake have stronger bones, lower fracture risk, and overall better bone health. Asterisk. Vitamin K activates osteocalcin, protein that binds calcium to the bone matrix, making bones denser and more resistant to fractures. Spinach, kale, Swiss chard, collard greens, and Brussels sprouts are rich sources of vitamin K1. However, vitamin K2 found in fermented foods like natto, aged cheeses, and certain animal products is particularly beneficial. K2 stays active longer and plays a greater role in directing calcium into bones rather than arteries. Asterisk. If you are on blood-thinning medication like warfarin, consult a healthcare professional before increasing your vitamin K intake. It affects blood clotting and can interact with these medications. If you're on warfarin, always coordinate any vitamin K changes with your INR checks. Asterisk. Next. The final vitamin that repairs your muscles and keeps nerve signals firing correctly in your legs. Essential vitamin number 7, vitamin B6. Asterisk here's why this is the nerve signaling and muscle repair vitamin. Vitamin B6 plays a far bigger role in leg strength and muscle function than most people realize. Asterisk. It's essential for maintaining nerve health, supporting muscle repair, and ensuring the body efficiently uses protein to build and maintain muscle mass. An overlooked aspect of vitamin B6 is its connection to nerve signaling and coordination. When B6 levels are low, these signals become sluggish or misdirected. This leads to numbness, tingling sensations, and unsteady walking patterns. Many older adults mistake these symptoms for age-related muscle loss when their bodies are simply lacking the right nutrients for proper nerve muscle function. Asterisk B6 is abundant in poultry, fish like salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals. A medium-sized banana, about 118 grams, provides approximately 0.4 milligrams of B6. Incorporating these foods into daily meals naturally boosts B6 intake, supporting both nerve function and muscle strength. The daily recommended B6 intake is around 1.5 milligrams for older women and 1.7 milligrams for older men. Putting knowledge into practice now. Let me walk you through putting this knowledge into practice. Consider working with a healthcare provider to get tested for specific deficiencies, especially B12, vitamin D, and magnesium. Blood tests can reveal which nutrients need attention and help you avoid unnecessary supplementation. Asterisk focus on food sources first, as they provide vitamins and forms your body recognizes and absorbs efficiently. Supplements should complement, not replace, a diet rich in natural foods containing these leg-strengthening vitamins. Today's nutritional choices can restore leg strength that you thought was gone forever. Asterisk the 7 vitamins we've discussed work together to create a robust support system for your legs. Vitamin D provides the foundation for muscle strength and bone health. Calcium and magnesium work in tandem for strong bones and smooth muscle function. B12 and B6 ensure proper nerve signaling and muscle repair. Potassium prevents cramps and supports muscle coordination. Vitamin K directs nutrients where they're needed most. Asterisk, now you have the knowledge to address leg weakness, prevent painful cramps, and maintain the mobility that keeps you independent and confident. This information can help you reclaim the leg strength and stability you need for the active and fulfilling life you deserve. Asterisk. Type yes if today's tips were helpful to you. Click subscribe and turn on notifications so our next friendly guide finds you. Then join me for our next guide on simple balance exercises that combine perfectly with these nutrients. Asterisk, share this information with your adult children, grandchildren, neighbors, or friends you want to maintain strong, sturdy legs as they age. Your recommendation could be the guide that helps them prevent falls, eliminate painful cramps, and keep them independent for years to come. Asterisk, stay prepared, stay informed, and keep making choices that support the vibrant, independent life deserve. Remember, this information is educational and should never replace personalized medical advice from qualified healthcare professionals who understand your unique health circumstances. Asterisk, Mr. Senior Health.